So, do I change this slide?
I don't want changing the slide.
You change this slide.
Yes.
How about here?
This one.
I'll change this slide.
Okay.
Okay. Okay, thank you so much. Well, I can start now.
Yes.
Okay, great. Okay, thanks to everyone for attending this webinar. So I'll be talking about telehealth failures and secrets of success. And I'll share some of my background and specifically talk about digital snake oil, about how all the key failures in telehealth. Then I'll share with you guys some 6 secrets and 6 advices in this space. And one of the themes for this is if you have any questions about startup in this space, I'll be happy to share with you guys some of my insight. So my background is I did my PhD at Stanford University. After I graduated, I co-founded the company in DC. And we've been around since 2008. We did 2 rounds of investment. We raised some money from Salesforce.com, some angels. And then we also formed a second company called This American Doctor, This American Doc. It's actually crowdfunding from a bunch of physicians investing. So that's an experience both from crowdfunding of physicians as well as raising money from normal institutional investors. And so what's interesting about the telehealth space is there's a lot of marketing excitement in there, but then there's a lot of these where it's the too much marketing hype. So for example, Kaiser Permanente, this is one of the largest healthcare systems in the U.S. Their CEO last year, in front of 100,000 people, said 52% of interaction at Kaiser Permanente are virtual now. And this got people got very excited. So all the mainstream press in the U.S. all written about this. People said, now telehealth is finally here. But the actual usage of video telehealth is less than 0.1%. So most people about this being telemedicine, but turn out that every time you log into electronic medical record, every time you, let's say, send a no message to your physician or your nurse, that counts as one interaction. So this is why even though there's a lot of marketing excitement, but the actual use case, actually the adoption is actually quite low. So my background is I mentioned, so after I finished PhD, I co-founded this company in DC. Our most famous customer is an astronaut. In fact, all video communication on the space station are done exclusively using South VC. In fact, you guys can just go to the App Store, download the free VC app. In fact, you'll be using the same tool that the astronaut uses for all communication. And this is something our engineers most proud of, because the previous system in this space was a Microsoft system, and it was there for about 30 plus years. And after NASA tested every single system on the planet, they actually picked VC to go into space. Now we're on the contract to serve them for 30 plus years. And then in the US, we serve again we have more than 1,000 customers from some of the big pharmacy chains like Walgreens, some large mega healthcare systems like DaVita, International Express, Kesson, did all based on system. What our company do is we also do quite a bit of medical mission overseas. So I personally have been to the Philippines actually a number of times. For example, last year we did a bunch of projects around Manila, in the adjacent, for example, we did some telemedicine project, did some orphanages, where place ideas. We could simply deploy on telemedicine system. Now you could provide care, bring the doctor in Manila virtually to all the surrounding places. And so this is, we also did quite a bit of volunteer work in Iraq. So first I've been to Iraq 3 times. So that what we do is we make a big clinic in a box. So we take this box to Iraq, and this is like deploying the refugee camp in Iraq. So the place we're operating in the city of Hope, which is about a 1-hour drive from Mosul, because ISIS is there, it's about 1 million refugees in the city, roughly about 700,000 people. You can imagine that we have a city, every other person is a refugee, the impact on our system. Then the picture on the right here shows that we also took a number of operational in Iraq. We turned it into a kind of surgery rooms. Again, turn out that you could do these fairly inexpensively, just $200 on equipment, and now you can actually turn OR into telesurgery ORs. Because in this case, you can have more experienced physicians to basically to connect with more local physicians to train them on more complex cases in there. So I was mentioning the theme of talking about telehealth failures in there. Telehealth began to, there's a lot of really exciting because the tons of companies are created. For example, we think, for example, by the University of the Philippines here, we got a great platform, like the medical center, all these, a lot of research. It's a perfect platform to actually launch many new companies specifically around telehealth. In the US, you see the tons of companies. In fact, today there's more than 1,000 telehealth companies. In fact, a new one coming out almost every single week. And the problem with the telehealth systems today is, so Dr. Rudnick, so he's the vice chairman of dermatology at UC San Francisco. So they did a study last year where they took 64 patients, submitted their the cases to 16 direct-to-consumer dermatology telemedicine companies, and the results was horrible. It basically was the medical result was so terrible that if this was actually a real doctor, physical practice, they would actually lose their license. It was so bad. For example, they were using things like one company was using doctors in India that didn't even have medical license in the United States. You cannot practice, right? Even like if you got a medical license inside, you cannot practice. And also things, for example, explaining the potential drug complications, the impact on pregnancy, like all these, like no discussion. It was really, really bad. So they don't share with you why it is that terrible. In fact, the American Medical Association CEO, Dr. Mudera, he said, essentially, today is like the digital snake oil of 150 years ago. So in the United States, roughly about 150, 120 years ago, you could buy snake oil that's magic thing, right? You just like go to a street vendor, they sell this snake oil, you just have magic cure for it. It doesn't matter what disease you have, buy this snake oil, it's going to cure your thing. It's like, literally today, in telehealth, we start similar things, like people are pushing all sort of these things in there. There's a lot of greed that's driven to sort of trying to make money quick, but the actual, the clinical efficacy is actually unclear. So I'll share with you 6 secrets if you want to make telehealth actually work. Again, not just marketing hype in there. Like, what do you do in there? The first secret is that don't spend money in there. So what I mean by this, I'll use Walmart as an example. Walmart is a big retail chain in the United States. They're one of the first in-store telemedicine clinic. I think you go to a Walmart store. As you walk out of the store, then there's a small office there. There's no doctors there. There's only medical assistant there. And now you can basically sort of almost like just get to see a doctor virtually there. And what we did there is that you just use the existing PCs and blood pressure cuff already did the non-digitized. All they did is spend $3,000 they bought on all-in-one general exam cameras in there. And by the way, there are a cheaper version of this. For example, if you're going to go projects in the Philippines, you definitely do not need to spend $3,000 to buy it. You can more spend a few $100s. You can actually get a general exam camera. And then you also bought a $600 digital stethoscope. And that's it. That's already powerful hardware. This is the cost you can launch to actually turn a Walmart store into a digital clinic. So we think, for example, in the case of the Philippines, is we imagine like if you think like all the MAR, the murky drug, and not just like all the street and those things. Those are natural places you can turn them into a telemedicine clinic. In fact, in this project, we think it would make a lot of sense. You go outside major cities, turn even a gas station, for example. If you go to a gas station, you just have a single, some laptops and devices, to turn those into these sort of medical clinics. And the first 3 months it became operational, we were seeing about 10 patients a day. And what was interesting is, out of the roughly about 1,000 patients we see in the 3 months, only a single patient said, I need to see a doctor physically. I don't feel comfortable seeing a doctor on the video. Every one of them, and all the other people, they just like, no big deal. One of the CVS, the big pharmacy chain in the US, they also did a telemedicine and obviously remember their in-store clinic. What they found is 33% of the patients actually prefer video over in-person. And one of the reasons for that is that in telemedicine, people explain, like for example, you can do an ear exam, through exam, you can see what's happening on the video screen. You can sort of get to explain the physician explain what's going on. So that explanation time is really, really interesting to them. By the way, my scholarly talk is a lot of things. I will not cover every item on this one, except feel free the slides will be available for you guys to see afterwards. You guys feel free to ask questions. The second secret is train everyone on interaction design. When it comes to healthcare, so a lot of times the product that's created just unfortunately is very difficult to use. Everybody talks about ease of use. Well, what is the mechanism you do this? I'll give you some examples. MD Anderson, this is probably the world's most famous cancer treatment center in the US and globally. This is where people around the world go to the place to get a treatment center. Again, this is where all the just like the best of the best, right? This is the place. So they introduced their Epic electronic medical record system, and after they introduced that, they had to lay off 1,000 people. Imagine that 1,000 people lost their job because when they introduced the EMR, then because the productivity decreased on all the physicians and nurses, again, you just spend time training, you don't know how to use this, how the decrease in productivity, 1,000 people lost their jobs. To me, it looks insane, right? How the people pick a software, and 1,000 people lose their jobs. And it really comes down to people didn't understand interaction design. So one of the so our recommendation, interaction design these days, you do not need to go to school to get a master to become an interaction designer. But you should know the equivalent of 1 plus 1. What is the equivalent of 1 plus 1 in interaction design? It doesn't matter what software you're going to use. In fact, this applies to not just telephone in general. You print a screenshot of each of the steps you go through. And you write a number on the number of visual elements that you should lay on the sheet on the paper number step. If you just do this, we go often find the number step a little bit atrocious how many steps. And then this is what you do service. And the rule of thumb is typically if it's a consumer software, every extra click is about you can expect about 20% of user attrition. So in this case, since it's the healthcare, you're not like the people still use it to get forced to, but again, this will lead to productivity decrease and so on. So the third secret I'll share with you is a focus on provider engagement. So provider, these are the medical. In the US, there's people call it, there's a patient. The patient loves telehealth. Then there's a payer, the insurance company, the government, the people who's actually using it. Typically, the payers that love telehealth because they love to save money and share the resource. Providers, not so much. So here's the insight, right? So you as a physician or a nurse, you offer telehealth to your patient. You get paid more? Vast majority like no. So what is your incentive to do telehealth? What's that? Importance. Sorry,
Importance. The right generation. The one you need to have for decision making or analytics.
But what's the incentive? You're a physician, you're a nurse. What is your incentive of doing telehealth?
A good lighting.
No, that's pipe dream. Think about this is where like what startup and reality meets. Right? You're a physician. You're so busy already. You don't get paid more or do something. You have zero incentive to do this. Right? Think about you're a physician working down the right across all the healthcare system in there. Right? So on top of not getting paid more, You have to see more patient, need more software, make your life more direct. So this is why telehealth has not taken off either, because there's no incentive with it. So what I mean is, you as a nurse, you as a physician, when you wake up in the morning, you don't think about, oh, I gotta get more data, I get all this. At the Ministry of Health level, of course, people want that. But this is why, unless you have the provider education there, you're not gonna get telehealth. You could do a pilot, right? You could do a pilot, you could do a marketing study, you could get, write it in newspapers in there, you could do all those. But to actually get mass adoption, no, you're not getting it. So this is the answer why providers is really important. So in general, is good physicians are very busy already. You're a good physician. You have so many patients waiting to see you. They're already coming to your clinic. Why would you put up with telemedicine? There's no incentive, right? So turn on that. Bad physicians, they have to make some extra money. They'll do whatever it takes to make some extra money. Would they do telehealth? Yes, sure, why not? Is it once they can make some extra money, they'll do some telehealth in there. This is why is that in fact, you think about, for example, I mentioned these were all these were direct-to-consumer telehealth company. Why was the quality so bad? What's your guess? Because these direct-to-consumer companies, they're not enough money to pay for physicians. Only the worst physician will join these good services. Now, you as a patient, you go to telehealth, you get very poor quality doctor. Now, of course, you're going to get poor results. Why is a good physician not out there? Because there's absolutely no economic incentive for them to be in telehealth. Right? Unless you have economic incentive out there, you're not going to get adoption out there. Another secret in there is like, is your IT paid to telehealth. So oftentimes we do a telehealth projects. So you start out with get some physician, nurse involved, get some administrator, get some business people. Next thing you know, it just becomes this massive project involving legal, IT, and all these things. But often in the organizations, especially large organizations, IT that really paid to say no. What I mean by this, so we have like our company with a lot of IT. They do a heroic job. It's not to disparage them. IT is responsible for example, every day your system is getting attacked by virus, these sort of damage, all sorts of different things. Right? So they're paid to make sure your infrastructure works, your email work, your servers work, your database is secure. That's what they're paid to do. To deal with that type of mentality, we say here's the new thing in there. Of course, the first inclination is no. Okay, do they get paid more? No. Is that glorious stickers? Yes, but that doesn't pay the bill, is that right? So again, so the inclination. In fact, if they spend 2 hours working on a telehealth project, their email goes down. Guess what? They're going to get fired because the email goes down. So why would they possibly spend the time helping the innovation project in there when they have to worry about the latest, security flaws, all these things? So what we recommend for this, right, really is to work with the IT. The whole idea is IT should not be the decision. They should just be created for almost a sandbox about it to run it. What we recommend is you should try to do 1,000 experiments in parallel. Because there is a lot of ways people are making lots of money in telehealth there. So the idea is to do a lot of experiments, and this will allow you to figure out what works and doesn't work. So one of the things, think about these sort of telehealth projects, in general, even when you think about creating a company, there are two types of decisions in there. One is called reversible decision. One is called one-way decision. Have you guys heard about what this means? So a reversible decision is meaning is that you make a decision is reversible, meaning you pick a place to eat a restaurant. You go in there, it's terrible food, you can leave, no big deal. Right? One-way decision is you decide to jump off the airplane. When you jump out, the parachute is open. There is no way you could go back to the airplane there. So I mean, when you go, so in business, often you have reversible and one-way decisions. By the way, one of the things for people you guys think about start a company, I highly recommend Jeff Bezos, the Amazon CEOs. Every year, he published a shareholder newsletter in there. It's probably the best business tip advice I can give you if you're just interested. I highly recommend reading it. So let's talk about this idea. The whole idea is most people make decisions, do everything like one-way decision. If you think about what happened here, typically the decision involving, let's say, last week in there. Often is the reversible, but the way the enterprises compete so using this one-way process. And I'll give you an example. So we actually did a lot of work with the Navy SEALs in the US here. So they have deployed VCs in all sorts of countries. So when the Adam was killed, we were actually working with the Navy SEALs and the Team 2 exercise. We paused, made the celebration, and continued exercise. If you look at, let's say you're a Navy SEAL, right? Very clear about you're making a reversible or one-way decision. If you're not clear, you will die. So in this case, right, you have devices, a small team get together, you're very rigorous on how you make decisions. One-way decision, you're very careful and methodical making these. Because reversible, just like quick decision. Another way to think about this is people study the fighter pilots. They say study the survival rate of fighter pilots. Right? This is a very intense job, right? So the way you think about it is that people call the OOPA, right? You observe, you orient, then you plan to take action. You constantly make that move in there. If you make that move fast enough in there, then you will die. In the case of business context in there, right? If you want to make a startup, you do this thing. If you don't execute carefully with this, you will waste a lot of time. You're going to be very slow, and then your company will die. And in general, there's also a bunch of issues that we call big issues that are not that big. Because if you go to things like these telehealth conferences, or you talk about reimbursement, equalization, all these things, it's just they're overcome. In fact, the big really is not really just physician quality. It really comes down to how do you get a good physician involved in telehealth. And what's interesting about direct-to-consumer, right? It's the most famous telehealth company in Teladoc. So this is a company that went public about 2 years ago. Teladoc, last year they had $120 million of revenue. Guess how much money they lost? 62. Imagine if you're a company, you're losing that much money. Like, you're under severe pressure to cut costs and cut everything there. You should make sure the numbers being correct. So this is really dangerous. Like, one of my advice, if you think about sort of these sort of telehealth startups, if you want to go after direct to consumer, dangerous. So the sixth tip for telehealth is, right, there's a bunch of different business model about sort of telehealth there. So again, there's a bunch of these different companies. What you do is, again, just sort of study different variants of these. Often you will find there's a pattern you will how to make money, how to lose money. So one of the things is, telehealth, there's two types of companies. One is we want direct to consumer. I mean, you put your phone, you see a doctor, and then the second one is a virtual specialist, what people call physician extender. So the whole idea is, for example, the patients at one clinic, you don't have the specialist in that clinic. You can use telemedicine and bring that physician virtually to this location. So again, this model, as mentioned, is people are losing lots of money in there. It's a company that raised over $100 million of venture capital back in this. Company are making money. Company are thriving. And one of the reasons for that is how you pay is a very clear payment model. I don't see that model. You have a payment model that make actually the physician to be sort of interested, the physician to be sort of. Another typically like a caution tale is there are over 250,000 digital health apps in the App Store. 99% of them, right? You build it, you launch it, 2 years later, no one cares. Now, why is that? That's what I guess. Why is that? for why these were the 250,000 digital health app created. Right? These are again people, doctors, tech entrepreneurs, and they're doing all this. We build it, ultimately spend hundreds of thousands of dollars, some millions of dollars creating that. They launch it, and pretty much 99% will fail. Why is that? One guess.
Apple Store.
No, these are all proof app in there, right? These are all proof app in the release there. Huh? That's correct. But why is the adoption? Why does it have platform adoption? The term of psychology is right. People trust their doctor because app. Right? So the app is only a medium, one method for you to communicate. Here's the thought experiments, right? So for example, if there's a really good doctor you want to talk to them, it doesn't matter whether you use your iPhone or Android phone to call your doctor. Most people talk to that doctor. Yeah. And this is why all these people they assume the app is important enough. That people like doctor, people like healthcare system in there. That's why this is cool that people are against just creating app left and right in there, right? Still creating this. This is we advise audiences like that actually is fairly dangerous. That if you assume you startup and build some app, people will come to you. It's really, really hard. Again, this data is against zero. So I'm now segue into the sort of I'll share some of the startup because I'm a first-time entrepreneur, so I have never done startup before. In fact, during my PhD, I was really just like I love research, I love just like the reading paper, and I love doing this thing. And now these days I do sales and marketing. And every day I wake up, it's about making money, it's about selling something there. And I'll just share with you some of the things I learned there. So one of the things about it, I love startup. I would encourage all of you to think about startup too. So I was fortunate to, for example, in the process, we to work with also really interesting people. For example, Michael Dell invited me to speak at Dell World who was chairman. I know the first chief technology officer in the United States really, really well. So we have Ash Carter, who was the U.S. Secretary of Defense under President Obama, and Bill Perry, the U.S. Secretary of Defense under Bill Clinton. He actually came to our office to literally have this tiny office, but their entourage was like more than 1,000 employees. Imagine two U.S. Secretary of Defense coming, and we did a couple of projects with Rock Band, Linkin Park. It's really nice for our team, like how to hang out with them. We did Hannah Teeter's one of the Olympic gold medalist and snowboarder. We did some project. Again, so for me, it's one of the reasons like just able to do a startup. You actually get to just have a really interesting experiences with a bunch of folks in there. And this is one of the things I recommend. I think it's like really interesting app in there. But of course, it's also very dangerous. Just think yourself how dangerous the path is. In the United States, every year there's about 600,000 companies created. Globally, there are 17,000 companies created every single day. And then in the US, out of these 600,000 companies created, every year only about a few thousand get invested. And out of that, about 100, 200 companies get to sell out for $50, $100, $200 million. And out of these, only about 10 companies get to have $1 billion exit in there. So basically, as you're coming out, literally you started with 600,000 companies in the US, but globally ready to go there. So you actually go down to one of the handful in there. That's why the failure rate is just enormously high in there. So how do you think about if the failure rate is so high, why do people still company in there? Or one is just this really interesting life in there. And one way that we think about this coming out, into my startup is just everything's about minimizing risk. As you come out to do this company, you have a chance to create something, but you think in a way we can minimizing the risk so you can face not just like a random gambler. The random gambler, 600,000, you you might as well take your money to gambling, right? You might have better luck than that. So if you could systematically think in a way to minimize this, you actually have a way to actually. The first advice is we call micro learning. So to be thriving startup, you have to be a ferocious learning, right? I mean, you have to learn like crazy. So one of the tips I practice every day is if I go to sleep, I now think of 3 things I learned that day that I consider a failure. It's very small things, right? The whole idea is that micro learning is not about learning is bigger in there, right? It's about very small things really learning. Another thing is about breaking the pattern. So I recommend tonight when you go home, the other hand to brush your teeth. You actually more of it while brushing your teeth just stand on one leg. When you walk to school, you use a different path in there. The reason for this is our brain, right, we're very good at autopilot. Right? So often poor decisions are made because you're on autopilot. You actually didn't break a pattern. For example, just when you brush your teeth, it's a very different sensation in there. You actually break your mind and start thinking and make better decisions. I think you should ask your real critique, try to critique. What I mean by that, we're socially, for example, in the US, people are fairly, generally, you're not supposed to make mean to other people. I think in the Philippines, the culture is very gracious, social. So generally, it's like, why would you critique someone? Right? If someone is so excited to come to you, I got a new startup idea. Like, if you want to, even if you think it's a terrible idea, very few people say, oh, this is someone's idea. But you as a startup company, if you don't hear that, you will end up, right? It's better for you to fail early rather than spend 2 years in life. Like, oh, that really was the dumb idea. How can now my friend told me about it? Well, because culturally, it's the thankless job. Right? Chances are, if you say that to your friend, you might have damage relationship. But this is what you as a person cultivate from your true friends, where they actually really feel comfortable critiquing you. If you don't do this, you actually are chances of making very poor decisions. The second tip is aim for boredom in there. And this is going to, for example, we have social media, we have all these things in there, right? It's like everything we do in society, we try to steer away from boredom. The problem is when people study brain pattern, right? If you're never bored, you will never be creative. Right? Creativity requires boredom as the foundation, as a pre-stage. Again, this is again just a fact of how our brains work. Right? And if you're again, so in this case, what you're doing is you ideally want to create some cultivate your daily life in there, that you can find times where you actually feel bored. Okay, if you don't feel bored every single day, you will make very poor choices. It's a terrible thing to create a startup in there. The third tip is learning sales in there. So again, especially I come from a university background in that before I do my company. I thought you guys will cultivate startups in the most of the people are professors, physicians, students in there. So they're going to be very good at technical stuff in there. But I think they're going to be terrible at sales, just like I was. The problem is if you don't know how to sell, you have no startup. Because at the end of the day, startup is about making money. It's about understanding the psychology of why would a physician use this, why would a physician not use this. It would understand that, like in the more rigorous and purity in the sense. But otherwise, if you don't understand the psychology, chances are you will do this thing 3 years later, you're going to find out something. In terms of learning self, there are different things that are powerful in there. Right? We just one of the audiobook, I could exercise, I could go to school. Again, so salespeople typically they make a lot of money. But they make a huge impact on this. I can share with you, for example, our company. How many of you guys know Salesforce.com? This is the largest cloud company. It's I think about $30 billion market cap in there. So we have Salesforce.com as an investor. So I don't know Salesforce in there. This is how we got Salesforce investing in. So Mark Benioff, he wrote a book called 101 Steps to Cloud Computing. It was a really good book. Turned out that, not to criticize, but he was he's a very good marketer. The book is really not about cloud computing. It's about all these just startup marketing tips in there. Okay, I highly recommend startup. You have to read that. So in the book, at the end of the book, there's his email, ceo@salesforce.com. So I don't know him, but this is a billionaire. I'm like a nobody. This guy just wrote an email, and he responded within 24 hours, and then the money was wired to our account in 3 months. Massive investment. How do you do this? It turned out that I had written a cold email to a bunch of these billionaires, and the response rate is really high. For example, like on Amazon, Jeff Bezos, he responded. Created the famous big credit in the US, and he responded. So turn on the trip to writing billionaires, like any powerful people in there, is figure out what time zone they're in. Then during their Friday or Saturday midnight their time, write the email at that time. Why is that? What's your guess? Yeah, well, these guys are working all the time, but it's pretty close. Essentially, for these guys, right, they do one-pass email process, right? They get so many emails. I mean, if you send an email during the normal work week, guess what? First, they have more email volume. On top of that, they're thinking about their business in there. They're just like, they don't have the mind shift past that. Friday, Saturday, midnight during their local time is when they have the fewest email coming in. And that's also when they take a break. So they want to, it's almost like this kind of rethinking about their core business. Now they want to switch gear into think a little bit again. So this is why that's the path, right? The mistake in there, right, is you actually, when you write this email, if the person doesn't respond the first time, it's okay to write them again. But here's one of the mistakes people do. It's like oh, dear, this billionaire person, I wrote you an email a month ago. That's a terrible thing. Why is that? Why shouldn't you say, remind them, I wrote you earlier? Yeah. The problem is that when you write that, right, first when you're implying it, I wrote you again a month ago, you didn't respond to me, how come? You were like, right? It's like, you're nobly, you're writing a billionaire, right? And so that almost you're implying, make them guilty, right? You do that with your friends, say, oh, okay, you missed my dinner, it's how to take on my birthday. For your birthday, it's okay. When you're writing a billionaire, just turn them off, right? So every email you write to them, you should assume they never saw your email. Because chances are they probably never saw your email anyway. So adding that extra phrase is a good complete waste of time. Just start from scratch, assuming it's like, now when you do the email in there, usually your email subject line should be about 6 words in there. I recommend adding the word investment in there. People love hearing about some sort of investment because imagine you're building a tech company. What are you worried about? What give you nightmares? Your nightmare is about the new startup that you haven't heard about in 5 years will kill your company. And this is what companies worry about. So for them, it's about on the startup investment is a way for them to understand what's coming there. That's the incentive for them to know it. And then adding, so I recommend is if you're really not looking to invest in one of you, if you have the money, you're really not looking to invest, adding the word invest in that because it increases the response rate by a huge amount. No fanboy. You know what no fanboy means? When you write this email, right, you don't want to spend it like long paragraphs saying, oh, dear billionaire, I read all your books, you're so amazing, I've been a fan of yours since I was 5 years old, all these things. Here's the problem, right? You're wasting their time, right? Imagine a guy like a woman like that. They get that all the time in there. Like, they just hear one more like this plot. You just completely wasted their time in there. They don't hear that. Like, get to the point, right? It's what do you want? Like, how are you adding volume? Teach them something they don't know. Again, the psychology is, even though there might be a billionaire, but the things that you know, this billionaire doesn't know. If you could convey what that thing is, you're adding value to him or her, they're going to respond to you. That's why no fan will just give us. And always end your email with an ask call for action. What do you want? So I find the startup community in general very nice. Why does it play not just building across the industry in there? So people, the whole idea is to pay it forward in there. Right? You can ask people for introduction, you can do this in there. People will help you in there. But you cannot do a vague in there. Right? Imagine the people are very busy. You can't just go and say, you have to be very specific. For example, could you introduce me to this person? Adding the LinkedIn, the profile in there, right? Just like that level. You want to make it so easy for them to help you. If you make it easy enough, they will help you. You can be specific. Another thing for the startup in there is, at the end of the day, right? So most startup, you start when you get exciting, your honeymoon phase, then you go through the valley of fire or the valley of death. You know? That's what most companies are, right? Just like when you started out stuff, it's really exciting, right? Just creating new something, right? And it's exciting in there. But all started eventually ran into some issue. I mean, it was very few exceptions all like that. When you go through the valley of fire, that's where company dies in there. So if you don't fund create a company as a leader, right, you have to actually become a good leader. So, Lincoln, my favorite American president, pettiness of firepower, but take greatness to exercise power. And this is one of the roots of why they are still great leaders. Your homework assignment, you should read this out. It really is because this will let you understand even the leaders in your bosses, how the then for you is you actually have to be able to great leaders. This is like the starting of the great leader. First is chances are you're not going to have enough money to pay these people when you hit that valley of fire. Right? Now, why will people still follow you when you're not paying them? They could get a better job paying someone else. It's only reasons because they believe you as a leader. If you're a bad leader, your company will die because of you. As a leader. One of these were typical. How do you hard power, soft power? Another thing we recommend is the Philippine culture, right? Everyone serve, boss, all these things, which actually in my mind is horrible for creating a startup. Right? So you have to say it's like every people, you as a leader, right? You need to communicate on first name basis. Like in our company, the word boss is not allowed. It's a four-letter word. This is you as a leader, you have to get people have to follow you because they respect you as a leader. You can do the best at what you're doing. Work harder than anyone else. You can make good decisions. Not because of anything else. And have you heard of the mirror versus glass leadership? How many have heard of it? The whole idea is a good leader is when something goes great, in front of them is glass. That means the team gets credit. When something goes bad, they have a mirror in front of them. Themselves take the blame. Of course, you all know probably a bad leader who does the exact opposite. I know you guys, you work with them because you have to deal with them. But imagine this: you have a choice. Will you follow that person? Definitely not. In the startup together, as soon as something goes bad, you're jumping ship in there because that's not a good person. How many know the sandwich method for? You must learn. I think this sandwich method applies to your daily relationship as you interact with your husband, wife, girlfriend, boyfriend. You must do it. The whole sandwich method is the other person, whether you're a significant other or your team members, you have to give them feedback. Something they're doing is actually not doing well. In fact, do you know what the CEO really stands for? Most people think of chief executive. It's actually CEO truly stands for chief editor officer. I mean, you're actually editing your team's behavior, making changes to improve them in there. So that's actually the #1 job in there to get the team to work on. Now, when you're giving the feedback in there, the whole idea of the sandwich method is First, you always praise in public. You never critique in public. You always critique in private. The reason is, as soon as you critique in public, people have this defensive emotional shield just pop up in there, that they're not listening to feedback in this. And for you guys who have boyfriend, girlfriend, or husband, you probably know this for day in, day out, right? As soon as the feedback, emotional, and then people, it's just like, this is just a rule of human life. Right? In the company in this, right? So when you critique, it has to become private to then make sure that you don't want to trigger that emotional shield in there, right? The first one, you praise the person, then you critique the action, then you praise the person. And this is called the sandwich method. The whole point of the sandwich method is about you want to make the person feel nurtured in the environment. Because your goal as a leader is to shape the action, to critique them, to have the behavior change. It's not about putting this person down, they feel bad about this, right? You could, many bad bosses, they do that just to act up in there, right? Okay, those type of bosses, guess what? You think people will follow them when you get that value fired? They're not. Right? So if you have these type of action, people actually will respect you. This is how you actually, this type of people actually follow you through the tough times. Yeah. Another advice I recommend, this might be a little bit silly for people doing startup in there. So the number one thing I recommend is actually don't follow your dreams. So you see all these people giving talks about follow your dream, all this, it's just sort of silly. You know? First, we know as a fact, it doesn't, that's just not the world works, right? The thing about when making startup, guess what? You're living reality. No BS, no saying this is reality. It's about understanding reality here. So if you follow your dream, chances are something very terrible will happen. You're going to lose a lot of money, you're going to be very unhappy, you're going to invest. The number of people who follow the dream that actually made it big, it's just so small that you might as well say, I'm going to try to win the lottery. That's my life plan. I'm just going to gamble on trying to win the lottery. Terrible way to live life. Why is that? They don't follow you. It doesn't mean you shouldn't have passion. You shouldn't be you haven't lived enough to know what you dream about, right? So one thing is very silly. You have, for example, you have young cousins. People ask you, what do you want to do in life? So I want to do whatever. If you're a 5-year-old, 10-year-old, 20 years old, chances are you have lived so little. You actually don't even know what you should dream about. You should really just go out and live life, right? Dream about, live life first until you have dreams. Right? For this one, change your dream frequently. If you don't change your dream frequently, guess what? What does that indicate about this person? Listen, you think about someone in your life who this person just like always wanted that thing and just not changed his or her life for the last 10, 20 years. What's something about this person? No, terrible learner. Like terrible learner, yeah. I mean, this person's, in fact, this person's mind is actually, in fact, there's some interesting study on the Vietnam, the US being on the war veterans in there. If there's a particular part of the brain is damaged, that means they're least likely to change their mind in there. So basically, you kind of know the certain people, right, the ferocious learner, right, they can realize their mistakes, then they pivot in there. The reason that's critical to startup, so everybody you can make mistakes in there. But it's okay to make mistakes in there. But can you realize your mistake and change it, right, fast enough? If you couldn't, your company will die. The problem is that people who dream at this big dream, they don't change it. This is, chances are they haven't lived enough to really understand what the dream. So fix on that. Really just, they're basically mentally tune on all the data that suggest they should really change the dream. Cannot do it. Those type of people doing startup, terrible. Like one of the things I recommend as your partner, co-founders and people who wonder that, ask them that question. This is critical that you do not want to get an employee or a team member on your team who know the way they make decision making attention to the money, right? So then imagine this, right? Then imagine all the time you have algorithms, terrible. Because startup is about fast learning, right? You go out and execute, you do something, you realize what mistake did you make, you pivot, right? all these famous examples of great company, right? For example, YouTube. What did YouTube started out as? Do you guys know? As a video dating company. The Twitter, what did it start out with? A podcast company. So it's almost like whatever you started out with, chances are, right? You take Airbnb, right? You complete somehow, they literally down to the like, ran out of money. These guys like, have no money to rent, they people rent. So you as a startup person, chances are you whatever your initial idea is going to be amazing. It's like not that hard, but right, you could learn fast enough in there to make it big. This is why it's really critical for you to be able to learn fast. And this is why we have these people with signs of difficulty of making changes at time. That's terrible. That's I almost like, if I keep in that your team is, like my actually honest recommendation is don't even start a company around. Your chance of making it is just not that good. And how do you get to follow dream? Learn the operating manual. Here's some example. In the US, you go to this high-end Japanese restaurants like outside, or tuna. 74% of the times, serve you not tuna. It's something else. It's not tuna. If you just search for this, you'll find that an interesting story. This is in some ways a little bit insanely statistic, right? But it is across from just across the board, including the most expensive, going there, like it's amazing. It's not about how much money you pay. And these are the things, right? You go back to it's like the decision of telemedicine is just like you have to get a more honest and rigorous understanding how the world works. If you don't understand it, guess what? You can make really flawed assumptions about your business idea. Guess what? You will fail. There's a bunch of these interesting things I recommend is read QC.com or way wide. Just really well-thought articles, podcasts, and radio lab, and spend the money on these. This is a simple thing, right? All these things will expose your mind to these different things. Fun is about learning about yourself in there. So if I find interesting about science, about just you get to do this, you actually get to find out who are you, type of thing. And one way that's a way to cheat learning about such to figure out biographies. And this is a way for you to figure out like just how many other people work. So the final tip I want to work share with you. To kind of remember one of the themes for the last 5 tips offered is the whole idea is about startup fail because people make poor decisions. And we as people outside of the startup, we often make poor decisions. And because of that, we don't get what we want in life, we make poor choices in there. Again, this is just a human so what's the basis for why people make poor decisions? What's the best guess? Because this applies to not just startup, but just life in general. Think about maybe think of your example, maybe one of your best friends who decide to date this guy or girl, but you just know this person is terrible for this person, you just date this person. After a year later, they find out you were right, they were terrible. Like, why did that person make that choice? I mean, yeah, the way that basically most people's mind work, right? Not 100%, I'll say vast majority there, is we make a decision. As soon as we make a decision, we look for data to support our decision. This is what the fundamental confirmation bias is. The moment you make a decision, you're like, all these data that tell you in the world that was a bad decision, actually ignore them. You only handpick the data point that you think. But this is just a human fact of human. And so if you look at the people, right, you can see all sorts of things. So the one way to guard against the confirmation bias is practice, just don't pass judgment. it's very hard, right? Just when this person, you know, whether it's a good person, bad, this restaurant good, I just like defer judgment. The problem is, as soon as you make a judgment, your mind is made up. So you start your mind turning to this look for data support my decision. This is a daily habit I recommend. Just do across your life. Don't make judgments. And another thing is cultivating people to help you just critique it. What I mean is, for example, a lot of the famous CEOs of Silicon Valley, they talk about the idea is when you make a decision, you have rigorous decision in there. You disagree with that, or you agree with that, you commit to the decision. As soon as the moment you made that decision, you actively look for data to suggest why your decision is a bad idea, why you should change your mind. So by actively thinking that way, you actually change your mind to break this pattern. Again, but one of the reasons why did we think this way? There's something wrong with our brain that we think this way. Well, it turned out that we think this way because we have to. You know, you guys all know Michael Phelps, you know, swimmer guys. Yeah. So there's a story, I'm not sure if you can, not the past of the previous Olympic, there were one of the races for the gold, right? He jumped in the pool in there, his goggles broke. And this is a, like Olympic race, right? Normally the difference between gold and silver is like less than a second in the right. Different. Your goggle broke, you can't see it. You're thinking, well, that race, you lost that race. Yes. One loss. How something should. Okay, what do you think? One will last. Last. I think so. Last is a good guess. But any other person, right? You would definitely lose the race. He won that race. The reason he won that race, so Michael Phelps will come out, right? The way he in the locker room, the suit up, the way he walked to the thing, every single step is precise in there. He's so well trained in there. So that means he does not deviate from that pattern. So in order for you to achieve peak performance in there, you have to have this sort of very brain autopilot. So when he's in the swimming pool, right, even though he couldn't see it, but every stroke, he knows exactly where he is, right? I mean, literally, he doesn't even need to. So well practiced, his brain is so in tune with it. He knows like every stroke where he is. And he actually doesn't even need his goggles to see. So he actually won that race. Yes, human beings, right? We're constantly have to do this because we're tiger there. You don't want to go analytic like the tiger is kind of eating, right? You're just going, you have to run away, right? If you don't do that, you will die. So again, this is why was also thing, driving all these different things we do, right? We actually need this like opposite is really like the thinking. This is why it's like why confirmation bias is a property of human beings because they help us survive. We actually need it in our life. But it's terrible for doing startups, so that's why you have to have able to turn your mind to actively how we actually switch out of this moment. And thank you so much for time. I'll just share with you. So I actually host a weekly webinar series called Telehealth Failures and Secrets of Success. So if you guys are interested in finding more about telehealth, every 2 weeks I interview a thought leader in the telehealth space in there. Which is almost getting free consulting advice from the thought experts in there. We also have a physical conference held in Silicon Valley in the end of September. If you guys happen to be in the Silicon Valley, definitely come in. You can see a lot of the biggest names are gathering there. My email is notimeVC.com. And if you guys say any question about free send an email, those are the VC just free app. You could just go download the App Store and just tell you the VC today. And thank you so much. Any questions?
Any questions I'll read the question for the webinar. All right, this question is from Dr. Yudha. The first question is it necessary to validate the ideas of future users before building the platform or the application?
Yeah, so definitely you should validate the thing. But I think the key thing is you need to validate. So what does it mean to validate the thing, right? So is generally is we don't have the research to do this full validation, like clinical rigorous study in there. So we want to recommend do what I call a napkin or restaurant validation. That may pull you to some of your friends, going to just together lunch in there to share the idea with them, just have a critique. Also, one of the ways to validate this is you can use tools like Envision or some of these with design to create some mock-up in there. You can do those without doing programming in there, right? So that's a very easy way to do this and just have them go through the workflow and see those are very quick way to validate.
His second question is, which comes first, the investor or the product?
Oh, yeah. That's where it's tough. Actually, ultimately has to do is your ability to sell in there. So what I mean by this, if you look at some of the greatest startup in there, you could raise money with just an idea. So people will write you a check to invest in just a brilliant idea in there. So for example, so VC itself, we actually had a prototype first before we get in investment. The one I'm saying is just like we had no reputation in there, right? By the time we created this smart conductor, so we had a reputation, 80-year operating history, thousands of customers in there. In this case, people were investing just the idea. And they're really us in there. So again, I think it's one of those things where it depends. But one of the things I recommend is, even if you're not, you should always be talking to the investor to pitch. That means investors are the best way to get free consulting advice in there. The reason that you talk to investors, even if you're not interested in getting they will give you critique, and that is a really good way to change your thinking there. So this is, I recommend instead of paying consultant, a lot of consultant you can hardly pay, so don't pay them. Just try to go raise money. You can get much better advice for your startup.
Right. His last question is it better to create a new market or shift gear the current market?
So to create a new market is really hard. It's very expensive. You either become a billionaire, you go broke completely. Because when you create a new market, it's really, it takes time to educate the people to all these things. That's very expensive. It really comes down to is about, you should realistically think, how much money can you raise? Write that number in there. Based on that number, that would determine the type of company you can create in this. So again, I recommend is like, if you don't have capital to raise a lot of money, it's actually better to come from the existing market to something better, faster, cheaper in there, or something their market gap in there to exploit.
There are no more questions in the webinar. We have questions.
So you know, do you have any experience asking
So I guess I have a little bit of experience. I mean, the VC was where I did my PhD at Stanford. I graduated as research there. So I have some experience, I mean, but not directly, but just some going through that process in there. I do have quite a bit of friends and colleagues who obviously other companies has created. I think in general, from spinning out from the university, I would say the number one mistake the university made is they make the term too for the actual analogy, right? Stanford and UC Berkeley, right? Two universities out in the Silicon Valley in there. Stanford make tons of startup. Right? Think about the greatest, some of the biggest companies from Google, Yahoo, Cisco, I mean, you name it, right? Like all these companies came out of Stanford. Berkeley, the students are just as smart in there, but what company you think? I mean, the different company, but which one you think about that came out of Berkeley in there, right? Literally, it's two universities within one hour drive of each other in there. The mistake that Berkeley made was they made the terms terrible for the founder in there, right? So they felt like, well, you're coming from the university, I want to get a bigger portion of the shares in this and that. And the problem is just the thing in that case is almost like making a startup is so difficult, right? that you just squash the company. You don't even give this company a chance to succeed. Versus Stanford, they take the approach that make the terms very favorable to them. But when the end result, right, all these people create all these billion-dollar company in there, then they go back and make a big donation to Stanford. So in the end, if you look at over the last decade of history, so I think the Stanford model definitely was not. So I think at the University of Philippines, I think you guys are setting these offices there. I would recommend advice is right. Don't do the Berkeley model, do the Stanford model. Make it really, really favorable to the entrepreneurs, like to the staff here, the students, the professors. Make it so favorable. Just you want to help them to just like get a chance to. I mean, some other things I think helpful. We see this. I go to Singapore a lot. I've been there like 30 times. I get invited to give startup talk there like all the time, probably every 2 years. I go speak at it like before and stuff. So what Singapore does a really good job is in the university situation, they actually specifically incubator. You can imagine you start a company first. Where's your office? All these, which is I was like, give them free office space, right? Because you have space here, right? It doesn't cost you as much to just create a space in there. Give them IT support, give them free server, give them bandwidth, give them like almost all the stuff that at the university research. Just help them get going. Because again, remember, like I mentioned, all these companies created, the death rate are so high. Anything you can help with the start a little bit extra support, I think you're going to get. Next thing you know, you're going to become the Stanford of the world.
Yeah. Just the next question. I'm just curious.
Yeah, also it's like, I mean, I think honestly sharing with you is because I was just very naive about startup ideas, right? So I had zero business experience. I like research. My favorite thing at Stanford is to just go to the library, check out the full research paper in the whole 100-year, 50-year history that like 2 people check out. I love doing those things. That's very different from doing execution. It's almost like the things I share with you. Not about the biggest mistake in their life. What mistake did you make today? It's about correcting micro mistakes. Every day, like improving. It's almost like, for example, when I go to sleep, it's like, I think it's here's 3 things I learned. Then when I wake up, I want to build a new version of myself. It's almost a new version of myself out there. I put it up. When I wake in the morning, that mistake has been repaired. Then in that case, right, it's okay, every day, because I can tell you like endless stories of all these mistakes and like how many times like company almost just died because the roller coaster. I'm very grateful that I haven't killed the company. Yeah, that's what it really is about. It's a pattern of how you think in there. So I read a lot of biographies. I love reading these sort of like as when they were, starting out and how they go. You can find these patterns. It's all about just chances are that whether really good news is. Someone asked me, is there enough too many smart people in the world already? What's the chance I can make? The company will be valuable. Turn out that if you look actually around the world, the society, most of the things, the way it is actually created by actually average people, average business process. Because I mentioned about this reversible one-way decision. It is just because some person, some committee made a decision 10 years, 50 years, you haven't do this, people don't. So there are a lot of these models you could create by reading. Almost like the endless number of problems you could solve. If you solve a problem, you will create a lot of value. Is a basic. That's why I'm actually think the ideas which endless you create a value, but when it comes down to execution, when you execute, you fast enough. It's often people ask me, is like when I get talks with or startup communities, like, who's your competition? So I actually really sincerely, your true competition is actually yourself. Your competition is not this other company or this company who do similar things. Your company, chances the market is big enough, especially in healthcare. Right? The market is so big that you can all find some various ways to make money. It's that your competition is like, tomorrow are you better than you today? The question is, maybe, then going is like you will die. If tomorrow you actually are better, right? You actually competing with it today, and you actually get better every single day, and making a small micro decision, then you actually have a great
Doctor, there's another question here from Dr. Yudha. He's asking, does BC routinely do user acceptance tests to measure its product effectiveness?
Yeah, we measure like everything. So we're very one of the way to avoid this bias thinking is data to make everything. So inside BC, we measure literally everything, every aspect of the entire user experience, onboarding, usage, we can survey everything. And we don't use to measure everything that we can make.
Second question is, what's your suggestion in today's digital health dynamic market to keep your company sustainable and keep innovating even there's a lot of competitors?
Yeah, like I said, I don't think your competition is your competition. Your competition really is like, are you able to make better decisions? I think the good news is, as I began to talk, right, the digital stakeholder kind of thing, the interest for digital health is huge. So many needs in the Philippines, right? The need for access for healthcare is huge. Right? There's so many companies you can create. There's so many things that can really add a lot of value to society, for people in there. So that's why my hunch is there's so many things you can do that's really amazing. Just come down to just pick something that you have some expertise in and start doing that. And but be really careful, be really mindful to make you change your mind frequently. Okay. Okay. Thank you so much for.
Thank you so much. Thanks. I hope we'll be able to.
Okay, I'll be happy.
So, is there a link to your weekly webinar?
It's just telehealth failures is secrets of success.
Oh, okay.
So that's the thing we. The reason we talk about this is if you look at how much venture capital money has been poured into telehealth, it's billions of dollars and poured into it. But because there's too much marketing hype, and so our whole model is we're talking about the failures, and from the failures we're going to pull insight about the success.